Paget's disease of the bone, or PDB, is a disorder that affects our body's process of bone reabsorption and formation through an increased osteoclast activity, which leads to enlarged and softened or weakened bone. Many people have no symptoms, but if their disease progresses to the symptomatic stage, they may require some form of treatment. Mr. Andrews has progressed to a level of dysfunction where he will require treatment. He was already having unrelieved pain due to the amount of bone deformity that has occurred. Now, due to his ground level fall, we have x-rays showing the femoral fractures and femoral head deformities. We will need to place an orthopedic consult for his current hip deformity and the femur fractures in order to determine if he will require a hip replacement or nailing for stabilization. We must work in coordination with the orthopedic surgeon to determine the timing for oral or IV treatment modalities in conjunction with his surgical interventions. A first-line treatment may be bisphosphonates, which work by accumulating in the bone and being taken up by the osteoclasts, who are then inactivated and undergo apoptosis, causing a reduction in the bone reabsorption rates. These can be either oral or intravenous, such as pamidronate infusions. Patients who have not had previous infusion treatments have higher rates of decreased levels of alkaline phosphatase. Mr. Andrews has previously stopped smoking, which is beneficial, but he continues to have the comorbidities of hypertension and diabetes. His blood pressure remains elevated at 150/95, so he may need his hypertension medications adjusted for better systolic control. We will need to check his A1C level to determine how he has been managing his diabetes, possibly obtain an additional MRI to determine if he is at risk for any neurological complications due to any skull bone remodeling. Mr. Andrews will also require physical therapy to assist with his recovery, and he may benefit from a non-weight-bearing exercise program such as swimming for long-term physical support.